Bhavani Fonseka, a senior researcher at the Center for Policy Alternatives, Colombo, Sri Lanka. Bhavani, from the perspective of the center, what is the situation on the ground today in the Vanni, in the embattled areas in the north of the country?
At the moment, Sanjana, there is several phases one needs to keep in mind. There is the hostilities that are continuing in the fighting zone, which is a small strip of land in the Mullaitivu coast, which has several names to it. The government prefers to call it the no-fire zone. I would rather keep it as the zone or the fighting zone, where over 50,000 civilians are still trapped. It could be between 50,000 to 100,000 civilians, but without independent access, no one really has a sense of the exact situation. But the immediate worry is the safety of those who are in that zone. Then we have those who are coming out of the zone, fleeing into government-controlled areas, and their plight also needs to be addressed. And thirdly, the situation of those coming into the camps in government-controlled areas. So it's not one situation we're looking at, it's several phases of it. And it's not putting priority over one, because the safety of civilians in all three zones or three phases need to be taken on board. But I would say if there's one urgent thing that everyone needs to be concentrating, that is to somehow get a humanitarian pause or ceasefire between the two parties and ensure the safe evacuation of the civilians trapped in the zone.
Bhavani, I want to come back to the issue of a humanitarian ceasefire because it is such a hot topic and it is hugely contested, as you know. But I also want to go back to the center's report that was, I think, released a month or two ago, where there were several recommendations on what could be done at that time to help with the situation on the ground. Now, of those recommendations, do you know of any that have been implemented, and if not, why not?
The Center for Policy Alternatives put out a report in March 2009, and this came out of field visits and discussions with humanitarian actors on the ground in Colombo, and talking to IDPs, talking to service providers, and first-hand witnessing what was going on in the camps, in the hospitals, and in those areas, government-controlled areas. CPA never had access, just like many others, to see what's going on in the fighting zone. And those recommendations were shared with national and international stakeholders. There was a discussion on those recommendations. But sadly, what we've seen is the deterioration of the situation when it comes to civilians. Recommendations have been slow in implementation, and those that have been implemented there are extreme worries as to what next with a large influx coming into government-controlled areas. So I would say a lot of the recommendations made in March have not been implemented. And it's really not to say how many have been implemented, but to really address how can we all, both national and international actors, address this extremely, extremely dangerous situation on the ground.
Now, you're on the one hand saying that the recommendations put forth by the center 2 months ago for a situation that arguably was better then than it is now have not been met. On the other hand, you argued also for the need for a humanitarian pause or ceasefire. How do the two gel?
Well, let's start with the humanitarian pause. We cannot move forward in a positive way if there is not an immediate ceasefire. So both parties, the government and the LTTE, need to agree to this. And the international community need to put pressure on both parties to come to a humanitarian pause. It's to get those who are trapped out of the zone, but also, as the UN has been pushing, especially Sir John Holmes, who was here a few days ago, push for a needs assessment team to go into the zone. So these are the basic things that need to be agreed by both parties. Unfortunately, the government, in its discussions, as far as we know from John Holmes' press briefing in New York, has refused entry for a needs assessment team. And this is just an example of other recommendations put by not just by CPA, but the UN, by the UN Security Council, by key member states, that it has not been implemented, and both parties need to take on board these urgent steps to address the immediate crisis on the ground.
We have recently seen both on the television but also on websites of the government videos featuring George and Daya Master, senior members of the LTTE, speaking on the conditions on the ground and how the LTTE is actually preventing civilians from moving into safe zones. Has CPA emphasized this fact as well and addressed the fact that the LTTE is also not allowing civilians rather, to get into areas for their own safety?
Let's be very clear. The report looks at both parties' responsibility, and in the report, in several instances, we say it's not just the government's responsibility, it's also the LTTE needing to respect human rights and humanitarian standards. When we talk about the LTTE, we have several reports of violations, from conscription to forced labor to shooting into civilians who are fleeing the zone, not giving food, urgent assistance among the affected community. So there is a whole list that we have put out to the LTTE as recommendations that they need to follow. And from reports we get in the ground, as I said, we don't have independent access to the area, but locals, doctors, humanitarian actors that we're still in touch with indicate that the situation is extremely dire because of LTTE action as well. But the government also, as the democratically elected government of this country, has a primary responsibility to look after the needs of the citizens of this country, and regardless of where they live, that responsibility needs to be met. And the government needs to respect the pledge they made on Monday, where they said heavy weaponry will not be used. And they made a pledge, this is when Sir John Holmes was also here, but from the reports we hear and from media reports, we realize there is still heavy weaponry being used in the zone. Now, without independent access, again, we don't know the exact nature of these weaponry, but we have heard of the hospital, the health facility that is still functioning in the zone being hit, several injured, several killed. So there is a situation where even the government's own pledges have not been respected. And then the question is, where do you look into and what do you do? And the point we have made in the report and continuously afterwards is that it is now up to the international community not just to have briefings, informal briefings at the UN Security Council level, but to take on board Sri Lanka's case as an agenda item and take strong action, because this is a situation where we have over 50,000 civilians trapped, many more who are still facing dire humanitarian needs, and urgent action needs to be taken.
In terms of what to do, Bhavani, there is a sense of urgency and increasing groundswell of support of citizens and fellow countrymen in the south and other parts of the country who want to send supplies to the Vanni and the north. Now, it is not entirely clear what access there is, but there are collection centers that have been put up across Colombo, for example, and many people are actually giving foodstuffs, medical supplies, etc. To the question as to what one can do beyond the politics of it to help with the incredibly bad situation on the ground in the Vanni, do you have any suggestions or answers?
Well, as you said, there are several collection points and citizens' initiatives to help as much as possible, and I think this is a great sign where people in the south want to help those affected by the conflict. And it's to see how that assistance can be delivered directly to those affected. As I said, there are restrictions in getting into certain areas. The zone is impossible to access. But the government-controlled camps and hospitals are possible areas where citizens can go and support. And I think in this initiative, one really needs to understand who are the key actors in control of the present humanitarian assistance drive. There was a competent authority appointed last week who is overall in charge of the assistance, and I would say everyone who wants to assist links up with the existing civilian administration as well as those specially appointed for this present phase of the assistance scheme, and work with them, because one thing you don't want is to duplicate efforts or give assistance that's not needed. What you need to look at is what is essential and then work from that angle onwards.